Well, right now we are getting startling new numbers in on vaccination rates in the United States. According to the Hollywood Reporter, in wealthy Los Angeles area schools, the rates are now down to as low as a third world country, the southern part of Sudan. Well, many parents are using the so-called belief exemptions to opt out of vaccinations, and the CDC now announcing some shocking new data of its own today. Experts say while flu vaccinations are up virtually across the board, just 63% of health professionals working in long-term care facilities got vaccinated last year, but that has to do with the elderly. Anyway, that's another issue, but let's focus on children. Those children are the most at risk. Let's bring in our medical panel right now. Dr. Daria Long-Gillespie, an ER doctor at Emory University Hospital. Dr. Manny Alvarez, Senior Managing Director at FoxNewsHealth.com and a Fox News medical A-teamer. And also Dr. Chuck Williams, Drexel University psychologist. Dr. Williams, let me start with you. Why are so many parents avoiding vaccinations for their young children?
Well, we can blame people like Jenny McCarthy, trained in infectious diseases, right? Obviously not. She's an actor, a comedian. She's been out there for years talking about how she's against vaccinations. And because of that, we sort of have this trend in certain communities where they are now deciding not to vaccinate their children as a way to prevent them from being from getting sick or developing something like autism, although there's no research to draw a connection or relationship between autism and vaccinations.
All right, let's make that clear. I have young children, and that's one of the pet peeves of my child's pediatrician, that there is no link between the two. Dr. Manny, let me bring you in. Dr. Chuck over there says it is affluenza on the part of parents. They just don't think they need it. Doctor?
Well, there's a lot of misinformation that has been developing now for decades. And as the doc said, many celebrities, wannabe doctors are moving forward. My position is much stronger than that. They hide behind freedom of speech. But in reality, when you place medical misinformation and you sort of disseminate it and become sort of something that parents and people attach themselves to, that is something that is illegal and inappropriate, and I think it's about time that the judicial system looks at some of the medical information being posted online and do something about it.
Interesting. Dr. Gillespie, let's bring you in. You are an ER doctor. You are on the front lines. You see children coming in. We've had outbreaks of whooping cough and also and measles as well, which has become a very big issue. What are you seeing in the hospital?
Heather, you're absolutely right. And as a mother, I understand wanting to do absolutely everything you can for your child's health. But as a physician, I have seen children that have been absolutely racked by pertussis. Their little infant bodies
let's mention to folks that's whooping cough. Pertussis is whooping cough.
Yes,
go right ahead.
Exactly.
Go right ahead.
Exactly. Pertussis is whooping cough. And they call it whooping cough because after they've had these spasms of coughing during which they cannot breathe, the whoop is them gasping for air. So I've seen them struggling with that. And I recommend and urge all parents to try to see it from both points of view, because I would want to do everything I can to prevent that from happening in my own child.
Dr. Chuck, this is deadly.
Of course, and back to the affluenza connection, I think that some of these well-to-do parents who are used to being able to choose what they want, like going to Starbucks and getting a latte with soy or not, they're putting this in the same category, but they're playing not only with their kids' lives, but with the lives of other kids. As Dr. Gillespie and Dr. Alvarez will tell you, we need to have a certain number of kids immunized to protect the entire community. So if certain parents decide not to allow their kids to be immunized, then we are putting the entire community and a bunch of young kids at risk, and that's irresponsible. And like Dr. Manny Alvarez said, it should be illegal.
Dr. Alvarez, I want to ask you about that personal belief exemption. That is on the books in 19 states, in which a family can just say, oh, because of my personal beliefs, I don't want to get my child vaccinated. Well, is there a movement afoot to do away with that?
There is, because unfortunately what's happening now, if you look at the passion of developing countries in getting their children immunized, and if you look at the rates of immunization, let's say in other parts of the world that have problems like this, the health professionals, the parents, live every day with the notion and the knowledge that children die before their eyes. So they see it. In California, in Hollywood, they may not see that, and therefore they have this assumption that vaccines are bad, that they sort of pollute our bodies, that it causes autism. I keep saying I have an autistic child, and I know a lot about autism. I can tell you I feel very confident about vaccinations. So hopefully this exception that's in the books to allow parents to opt out of vaccines, I hope it goes away. Now, the CDC, I tell you, has to do a better job in being transparent and giving parents clear information when it comes to vaccine safety.
Dr. Gillespie, let's bring you back in here. These diseases, just two that we're talking about, measles and also whooping cough, had all but gone away in the United States since the 1950s or so. Now they're back. Where is it coming from?
Well, they're coming. You're absolutely right. We had essentially eradicated these. In 1960, 500,000 people had measles and hundreds died. We had eradicated them, but they're still very populated in other countries of the world, and it's very easy to essentially import measles and pertussis and other infectious diseases from other countries, which is where they're bringing them. And to the point made earlier about vaccines and autism, there is no scientific evidence connecting the two, and there is quite actually very good evidence suggesting that vaccines have no association with autism.
All right, let me just mention the Hollywood Reporter covering this story in an extensive article about this. We're seeing this among a lot of parents in wealthier parts of California, and they also report that a couple children have died this year as a result. So this is a very serious issue. Dr. Daria Long-Gillespie, thank you. Dr. Manny Alvarez, and also Dr. Chuck Williams, thanks for the conversation about that. We'll keep an eye on this story as it continues to develop. But kids go back to school. Thank you.
Thank you.